Hi, friends. Just a quick update. Today is March 28th, 2024. This is around my path to having my surgery done before the end of the year, hopefully. So, since my last update, I did get to meet Dr. Ditzler. He is my new surgeon who is taking over for Dr. Chang, who is going to be going out on maternity leave by the end of the month. End of April, excuse me. And really liked him. He does use a Davinci device. If you don't know what that is, go look it up. It's kind of a neat little gadget. I don't say it's really not little, but it's a neat gadget to utilize to perform surgery. There are videos on YouTube if you want to look that up. If I find it, I'll post a link down below that will show you exactly what I'm talking about. It is the actual sleeve using the Davinci device. It's really quite neat. As a nurse, I like that kind of stuff. If you don't like that kind of stuff, don't click the link. So I didn't really appreciate everything that he spoke to me about. We had a 15-minute session to go over all the things, answer my questions. I got to find out that I didn't have to crush any of my medicine because they were small enough. He goes, it's not going to change anything as far as the method of taking pills. Now, that's my surgeon telling me that information. If your surgeon tells you something different, please do what your surgeon is asking you to do. So yes, but like with all things in healthcare, new doctor, new rules. So I had an upper GI done several weeks back, as noted with my last update. And so now he wanted an endoscopy. Not overly thrilled by that, but I've had worse things. So ended up having my endoscopy yesterday, and I'm really hoping not to cough during this video at all. My throat's still a little sore from that whole process. Nothing major came out of that endoscopy that I didn't already know. I still have a hiatal hernia he's going to fix during surgery. But they didn't find the diverticulum, so that was interesting. So during the debrief after the procedure, they tell you what they find. They didn't find anything. I got to see the pictures today. I didn't see it. And it's not in the note. So I don't know where the upper GI shows a diverticulum. I didn't ask either because, the drugs were just wonderful. So there's that. Also, fun fact, I got a particular rash, which is little red dots right through here. I don't know if you can see it or not. Probably not. You didn't want to see my old lady dark spots. But anyway, the PA said just take some Benadryl. That should go away. It doesn't really bother me. It's not sore. It's not itchy or anything like that. But it was as a result of laying on my left side. And they had to put like a little CPAP nose thingy on me during the procedure yesterday because I do have a little bit of sleep apnea. Also, fun fact, Dr. Chang, my first surgeon, actually did my endoscopy because Dr. Ditzler was out this week. So I did get to meet her. So now the next steps are I get to go through a pre-op class that I have not got on my books yet. And so I've asked them to please reach out to me so then that way we can get that scheduled. And also just waiting for a surgery date. So fingers crossed that we get something on the books before the end of April. And because Terry's schedule is filling up fast with the travel that he has to do. But I want to get this done before summer. So there's that. And also yesterday, I lost my 16-and-a-half-year-old kitty. She's been on hospice for about 4 weeks now, and she declined rapidly over the course of the past couple days. I've had the endoscopy scheduled, so I couldn't reschedule that, and I didn't want to because of obvious reasons. And tried to get her in the day before, and they were pushing things off until tomorrow. And I'm like, this can't happen. So Lap of Love, if you've never heard of it, it is a wonderful organization that will come into your house. They're veterinarians, and they do things in such a wonderful way to take care of your pet if you don't want to take them to the vet for that process. This is the second time I've used them with my Labrador. About a year and a half ago, I used them for him, and she did a great job. And the vet that came in yesterday, she was amazing, took care of her. She passed peacefully in my lap. But it's been a very trying couple of weeks. In the past couple of days have been very, very hard, and I've not slept well. So I'm hoping that over the course of this holiday weekend that I get caught up and not so stressed and a little relaxed just a little bit. So fingers crossed on that as well. Still meeting with my bariatric coach and doing all the journaling. And so I think today I'm going to take out some frustration and just anger and just sadness out on cleaning when I get done here shortly, because I'm done with work for the day. And so my next update, I'm hoping, will be having my surgery date. So that is all I have for now, and we'll talk soon. Love y'all. Bye.